an 8 original production.
Support for Ask an Arizona Dentist has been provided by the Arizona Dental Association and the Central Arizona Dental Society. Welcome to Ask an Arizona Dentist. I'm Ted Simons. Proper dental care is often the forgotten part of a healthy lifestyle. Untreated dental problems can cause not only discomfort and tooth loss, but have serious consequences for our overall health and well-being. Tonight, we bring you the second program focusing on dental issues in our Ask an Arizona Expert series. We will hear from a panel of dentists about how to avoid and treat dental problems and give our mouths the best care possible. We will also provide our viewers with the opportunity to call in and ask an Arizona dentist about their questions and concerns. Dentists will be taking calls throughout the show at the statewide toll-free number appearing on the screen. Phone lines will remain open until 9 p.m., so we encourage you to call. Joining me now is Dr. Koppikar, who, in addition to having his own practice in Phoenix, also serves as a director of the Central Arizona Dental Society. Dr. Victoria Griego, she serves on the Arizona Dental Association Council on Dental Care and Practices, and practices, General Family Dentistry in Peoria. And Dr. Gary Jones, he's Vice President of the Arizona Dental Association and is a second-generation dentist practicing in Mesa. Welcome to the program. Thank you so much for being here. Dr. Koppikar, let's start with a routine checkup, routine cleaning. How often should that be done?
For most people, you should go in about every 6 months. That way we can make sure your gums are healthy, your teeth are healthy, because that's about how long it takes for a cavity to develop and progress. Some people, though, develop a lot of tartar a lot more often, so they need to go in every 3 months. We have a couple of patients in our office who come in to see us every 3 months because they build up a lot of tartar, but on average about every 6 months.
Doctor, is that the kind of thing that a patient will know as they age? Hey, I'm someone who needs to get in there a little more often because of X, Y, and Z?
Hopefully they'll know it if they've been coming to the dentist regularly, because that's what we try to instill in them, is just a lot of knowledge about what's the proper recommended number of visits per year. Some people need every 3 months or every 4 months, but yeah, for the most part, every 6 months is fine.
And doctor, what are you looking for there for every 3 months and every 6 months? Routine checkup, what are you looking for routinely?
Well, routinely, we're checking a number of things. Number one, we're doing cancer screens. We're checking very close to make sure that the patient doesn't have cancer in the mouth. Number two, we check for periodontal disease, which is an inflammation of the gum tissue. Number three, we check for broken teeth, we check for cavities, we check for anything that might give that patient discomfort or a problem within the next 6 months period of time. And then we can recommend to that patient what they need.
The idea of x-rays, I know some folks are a little worried about having too many x-rays, doing it too often, these sorts of. How important are x-rays in dental exams?
You know, a lot of people don't realize that x-rays can be your best friend, because they actually help you save money in the long run, because with x-rays we can find cavities, we can identify cavities before they become really large. Because if we just rely on visually looking at a cavity, we have to, if we look at a cavity and see it like it's so big after a couple of months, we're looking at doing a root canal or a crown. But if we catch a cavity with an x-ray, we can fill it, we can do a filling and fix it before it gets really large. So x-rays are really important.
As far as those who worry, though, about health concerns with x-rays, how do you assuage their fear?
Well, we have digital x-rays now, and digital x-rays greatly minimize the amount of radiation that we expose our patients to. It's about 1/10 the amount of the old-fashioned x-rays that we used to do.
Interesting. A reminder now, the telephone number on your screen is for you to call and ask an Arizona dentist. Dentists are standing by with your ready to answer your questions and your concerns regarding dental care as we continue our conversation here. Doctor, we talked about people maybe knowing they need to go every 3 months or 6 months? Maybe as they age, they can kind of figure that out. Normally, as you age, do you need to go more often? Can you back off a little bit if you haven't had a cavity in years? How does that work as we age?
Well, it truly is up to the dentist and the patient. I have patients that are older that come in every 6 months like everyone else. I have other patients that need to come in more regularly. And so it's not so much an age, it's their condition of their oral health. So we look at, for example, calculus or tartar buildup. Some people build it up more frequently and quicker than others. So we get them in earlier. The thing that older people really need to look at, number one, they're a little bit more prone to periodontal disease, and they also have issues with root caries, which as we age, the tissue recedes down the root a little bit. So they're more exposed to decay. There's two kind of ages of decay. One is in the teens to the mid-20s, and then as we get older, because there's just more exposure.
That's interesting, because I think most of us, Doctor, when we're kids, either we are one of them or we know of a kid who just gets cavities all the time. And then as they get to be an adult, they never get cavities anymore.
Right.
Whereas the kid who's had perfect teeth, even though they ate sugar all the time, no cavities,
Right.
they get to be an adult, they got cavities. What's going on there?
Well, for the most part, it is genetic. You know, some people are a lot more prone to decay than other people, just like how some people have a lot more bone disease or heart disease in some people. Some people develop decay and cavities a lot more. So it's very subjective. It all depends on the person.
Is that how you see it as well? Genetics playing a big part in this? Or is it the kind of thing where clean your teeth and get it over with?
Well, there's a lot of factors that come into play in decay. Bacteria are involved. There's got to be a sugar source, and then the amount of time that the teeth are exposed to the sugar. And yeah, there can be different rates of decay just in the same family. I have families that one child gets all sorts of cavities and the other child doesn't get the cavities. So there's definitely genetics, but I don't want people to say, oh, I'm just prone to cavities because of my genetics. There's definitely a lot of other factors that come into play.
Is that how you see that as well?
Absolutely. I've got families that have, I've seen the grandparents, I've seen the parents and the grandchildren, and I know what line is coming down. I know that there is a line in that family that they're prone to decay. And so I help them with that by helping them with the right type of toothpaste, with the right care for their teeth. So
it's interesting you bring that up. Doctor, let's talk about a toothbrush, something as basic as that. Is there a good toothbrush, a better toothbrush? What do you tell patients?
That's a good question. There's really no good toothbrush. I mean, it's the act of brushing your teeth is probably the best thing you can do. So you can pick any toothbrush, you can use any toothpaste. As long as you're brushing at least 2 minutes, you're brushing 2-3 times a day, that's really the best thing you can do for your teeth. So use a toothbrush or toothpaste that's ADA accepted. Change your toothbrush every 2 months. You know, brush 2-3 times a day after every meal. If you're doing that, it really doesn't matter what toothpaste you use, what toothbrush you use.
I really disagree with that.
Okay, please.
Because probably no less than 10 times a day, I'm recommending an electric toothbrush. I think manual toothbrushes are way too aggressive. Medium and hard bristle brushes should not even be on the market. I recommend, probably can't say the brand name, but we call it the Bob in my office, and I always recommend 2 specific brush heads. One is the round head, and one is the, they call it a power tip, and I have my patients use that just at their gum line. So I really strongly believe in the electric toothbrush.
I agree totally with that. An electric toothbrush is a lot better than a manual toothbrush. So if you have the ability to get an electric toothbrush, get one. It cleans a lot better than a manual toothbrush.
Is that it because it cleans better, or is it because it protects the teeth and doesn't rip up your... I mean, what's going on here?
both. It cleans better. If you brush with a manual and you get electric, you will notice a big difference. The electric toothbrush just does a better job. Plus, it's really nice in the fact that it doesn't enable you to brush them too hard most of the time. Most of the time, it does the work for you, so you just put it on there and let it do its work.
And the electric toothbrush, correct me if I'm wrong here now, goes up and down as opposed to
Wrong.
most of us. It doesn't? I thought it goes like,
We're
you're not supposed to.
use our hands, but I have to use my hands.
Please.
'Cause I always show my patients the electric toothbrush oscillates back and forth,
Okay.
which is very gentle, and then it pulsates in and out. So there's a lot of action coming from those bristles that you can't duplicate with a manual toothbrush.
Okay, I guess the point I was trying to make though was you really don't want to see this side to
Right.
side, right? Because that's why don't we want to see that? What's wrong with that?
Well, if you brush really hard, especially if you use a toothbrush with hard bristles and you go with that back and forth motion, you can cause a lot of gum recession. And the good thing about the electric toothbrush is it does all the work. You basically put it on your teeth and it oscillates back and forth, it goes up and down, it gets rid of all the plaque without any pressure on the gums.
All right, we have dentists standing by the way. The telephone number you see on your screen. If you have questions, if you have concerns, anything regarding dental health, give that number a call. Again, dental experts and dentists are standing by. They've got answers for you. So again, they'll be there till 9 o'clock tonight. Give that phone number a call. Flossing, we've heard it forever. Floss, always do it, just do it. Why? Why is that so important, flossing?
Flossing is important because floss removes the food particles, the sugars that cause decay between the teeth. We talked about radiographs earlier. Those are where a lot of the cavities start, in between the teeth. If you floss, you can keep those areas clean, get the food out from between your teeth that act as sponge for sugars and other things that will hold it there that can cause decay. So, you know, there's an old saying, floss the teeth you want to keep.
And I'm going to ask you, because I don't want to ask anybody else and maybe get it wrong here, is there a better kind? You stand at the drugstore and there's 47 different types of dental floss out there. What works? What's best?
Well, I've changed my mind recently on the best floss. I used to like the flosses that were really super skinny and they slipped between your teeth easier because a lot of patients complain, oh, my teeth are too tight, I can't get my floss in between them. But those flosses I've found kind of just glide over the plaque. They don't really remove the plaque. So now I've gone to recommending a woven floss. It's kind of like yarn. So if you pull on it, it does stretch out and compress and get between your teeth, but then it expands in between your teeth and it pulls out more plaque and more bacteria.
What do you think about that? Do you have a favorite kind of a floss that you recommend?
I actually don't. You know, I tell my patients, you know, floss as much as you can, and it's so hard to get patients just to floss. So if they're flossing, I'm happy.
Yeah.
You know, just pick a floss and use it, and I'm happy.
Is that the way you see it as well? Or if, when next time we're standing in the drugstore, we can say, Dr. Jones said...
I would say if you find a floss that you like and you will use, buy it.
Yeah, all right.
Absolutely.
Okay. Obviously what we're talking about here is trying to prevent cavities. Let's start with what a cavity is. Define it for us.
A cavity is basically bacteria eating away at your tooth, in the simplest form. And if you let all the sugars stay on your teeth, that's what bacteria feed on, and they'll break down your teeth and start a cavity. So, you know, that's in essence what it is, and we want to prevent those. So we want to get rid of all the sugars in your mouth.
How long does it take to develop a cavity?
Sometimes as little as 4 to 5, 6 months. It doesn't take very long if all the conditions are right.
Is that how you see it as
Yeah,
well?
Ted, I had a patient that came in, had beautiful teeth. 6 months later, came in, had 10 cavities in 4 of her front teeth. And I was like, what have you been doing? What has changed? Well, she bought a big bag of hard candy, put it on her counter at work, and started sucking hard candies every day and handing them out to the other employees at her job. And so within six months, she went from no cavities to 10 because of the constant bathing of her teeth in sugar.
You mentioned sugar. Doctor, lots of sugar these days is being replaced by high fructose corn syrup. Does that hurt your teeth like sugar?
Oh, tremendously. I think that the high fructose corn syrup is probably the biggest culprit of cavities in this country. There's almost no way to avoid sugar nowadays because they put the high fructose corn syrup in bread, in candy, in milk, in fruit drinks. So people think they stop eating candy, oh, I'm not going to get a cavity. But the truth is that the high fructose corn syrup is in everything. So ideally, after every time you eat, you have to rinse out with water, and that's the best way to prevent cavities, because it is the biggest cause of cavities.
High fructose corn syrup, that bad for your teeth, huh?
It's just as bad as sugar, and he's right. It's hidden in everything. Even in fruit juices, if you read the nutrition label, apple juice has it in it, Gatorade has it, those sports drinks have it, and people don't realize it. So you really need to read the list of ingredients.
And I would imagine with kids especially, because so much of kids' stuff has sugar in it, high fructose corn syrup. When do you start taking a kid to see the dentist?
Very early. You can bring them in at 1 year old. That's when we recommend that they come in, that they get checked. We're just giving them, we're not going to clean their teeth. We're not going to do most, fillings on them. But it's good to get them in the office to let us take a look at what's going on in their mouth, to make sure that their teeth are developing normally, that they're coming in on time and the way they should.
Interesting. Again, that phone number on your screen, that's for you to call if you have dental questions. We have dentists standing by. They'll be here till 9 o'clock tonight. Give that number a call if you have concerns or questions regarding your dental health. Back to the kids. How do you prevent cavities in kids, especially when just about everything they eat has some kind of sugar in it?
The best thing to do is after every time they eat, have them rinse with water afterwards. And I know it's hard, but just avoiding candy is not the best thing to do, because everything has sugar nowadays. So rinse with water, go in every 6 months to see your dentist, and that's probably the best thing you can do as a kid to prevent cavities.
Well, Ted, as a parent, I would make sure that your child is brushing well also. Even if you give them an electric toothbrush, which they can handle just as well an adult, but it's very important that you supervise, that you make sure that your child is brushing their teeth. And for heaven's sakes, there's not a problem with flossing, helping them floss their teeth also at a young age.
For the really little ones, things like baby bottles and pacifiers, do they affect dental health?
Baby bottles, if they're filled with sugary drinks, do.
Sure.
It's really recommended not to put your child to bed with, even milk has sugar in it. So if you feel your child has to have a bottle, just make it plain water. Pacifiers don't cause cavities. They can cause some changes in the shape of the arch that supports their teeth if they are dependent on it for too long.
Okay. What is a sealant? And should those be used with kids?
A sealant is awesome. A sealant is a protective coating that goes on the tooth. Most of the top of the teeth have grooves in them, and that's what catches food and sugars and bacteria, and that's where a lot of the decay in our generation, our decay a lot of times is on top of the teeth. Well, with sealants, we can actually seal those grooves before they get decay. So we're seeing a lot less decay on top of the tooth.
Wow, is this something new, something we haven't heard of? Sealants, I haven't really heard of these
No,
things.
it's been around for, 10, 20 years, and I agree with Dr. Jones. They're amazing. I mean, it's a small little seal right on the tooth, and it prevents a lot of the decay from starting right on the chewing surfaces of the teeth. And because a lot of kids eat a lot of sticky candy that gets stuck on those grooves, a sealant prevents all those groups from getting filled in with the sugar and causing cavities right on the teeth.
Okay, I want to move off to the dental emergencies here, because I know this affects a lot of folks, and they don't know what to do. Maybe they've chipped a tooth, maybe they've broken a tooth, something along these lines. After hours, weekends, these sorts of. What does a patient do?
Well, I think the patient should put a call into their dentist, describe what happened with their tooth. The dentist will ask them if they're in any pain, if it seems like the tooth is bleeding, and then offer our best advice. And if we think it's serious enough, we'll ask them to come in.
Okay. Reminder now, telephone number, that's for you to call if you have a question regarding dental health. Dentists are standing by until 9 o'clock tonight to answer your questions. This is Ask an Arizona Dentist. As far as emergency treatment and these sorts of things, I'm sure we all have different stories along those lines. You got a story for us about people that are trying to trying to maintain when they've broken a tooth or something along those lines?
Absolutely. Just 2 weeks ago, I got a call. I was home on the weekend, got a call from my neighbor whose son was up wakeboarding, came down and knocked out his 2 front teeth. Just knocked them totally out. They're at the bottom of the lake, and the 2 teeth next to him were really moved, so that we had to get him into the office. We had to replace those teeth, put the ones that he still had in his mouth back in their position. And then the beauty is, this day and age, we can tell that parent that everything's going to be okay, because we have implants that can replace those teeth. We don't have to look so much to bridge work anymore, or to even removable appliances like a flipper or something like that. We have implants now that can replace those teeth, and that's the beauty of dentistry today. If you have an emergency, we have the ability to make it right.
Chipped tooth, broken tooth, knocked out tooth. Has technology really caught up now as far as making this? Because back in the old days, you were kind of sunk if that happened.
Yeah, I mean, just like Dr. Jones said, it's amazing what we can do now with teeth. If you've got a chipped tooth, a cracked tooth, you come in, we can put something in that day, and it makes the tooth look like it wasn't even touched, it wasn't even broken. If you lose a tooth, we can put an implant in, and it looks like a real tooth, and people would not even tell the difference. Wow. But that's the amazing thing about the progress of dentistry. We can do amazing things and make it look very natural.
You know, Ted, I just wanted to please examine on that. If you have an emergency, call your dentist, because if you chip a tooth and you can find that piece, we can actually put that piece back on. We have the technology that we can rebond that piece that broke off right back on the tooth. And so if you don't call the dentist immediately and talk to him and tell him about what's going on, you might not know to bring in that piece of tooth. You might not know, if you knock a tooth completely out, that you should not clean the surface of it, that you should maybe run it through some water, but don't scrub it, put it in some milk, you know. So those things you need to call your dentist and ask.
Wow. All right. What is a crown?
A crown is a restoration that enables us to hold a tooth together. A filling goes inside the tooth, whereas a crown goes over the tooth and holds all the pieces together. We have to go to a crown when we don't have enough tooth left to fill.
Okay, so again, as far as the procedure, long procedure, what goes on here?
It takes about an hour, maybe an hour and 15 minutes, but you know, we have to get our patients numb. We have to remove a certain amount of tooth structure to make room for the thickness of the crown. And there's many different materials we can use to make a crown. Usually it's some sort of metal. Usually, hopefully, it has some gold in it, high noble metal, and porcelain is baked to the outside. Or now we have all porcelain crowns, which look really awesome on your front teeth. Like they were saying, you can hardly distinguish it from a regular tooth, but that's what a crown is.
All right, if you have more questions regarding crowns, give that number a call. Dentists are standing by with responses for your dental health questions. We mentioned gum disease earlier in the program. Talk to us about what that means and how serious that is.
Gum disease is actually one of the least understood and least underestimated diseases out there, because it's linked to heart disease, it's linked to diabetes, and a new research just came out, it's linked to Alzheimer's disease. So everything's connected in your body. If you've got bad gum disease, you've most likely got diabetes, heart disease, your risk at Alzheimer's, your risk of a lot of other systemic conditions. So getting gum disease under control can actually help the overall health of your whole body.
Can you prevent gum disease, or if you have these other conditions, gum disease just happens?
Well, it depends. There's some medications that cause inflammation of the tissue, and you need to, talk that over with your dentist. But again, it gets back to prevention. That's what we talk about. It gets back to doing what it takes to keep your tissue healthy. A healthy gum is pink. If you get periodontal disease or you start with gingivitis, it turns red, it gets inflamed. If you have bleeding when you brush, then you need to get in and see what it's going to take to get those gums healthy.
Best way to keep your gums healthy, what do you do?
Electric toothbrush on slow speed, and flossing pretty much every day. There is definitely a genetic link with periodontal disease. So in most people, you can prevent it with excellent home care, but some people are predisposed to gum disease because of their genetics.
Last question here. We don't have too much time, but real quickly, someone's watching right now. Maybe they're calling in with a question, but maybe they've lost their job. Maybe they've lost insurance. What do they do if they can't afford to see a dentist?
You know, we always say that the best dental insurance is a 6-month checkup. If you're going in to see your dentist every 6 months, catch something when it's small, that's the best way to save money in the long run. Fix something when it's small. You know, we can do a filling instead of waiting 6 months or a year, and then it ends up becoming a root canal and a crown. Go in every 6 months, even if you don't have insurance. I understand it's a lot of money coming out, especially if you don't have a job, but that would save you a lot of headache, a lot of time, a lot of money in the future.
All right. I think that's a good place to stop right there. And again, thank you so much for joining us tonight. Thank our panel of experts for joining us. And remember, dentists are available and will be available to take your calls toll-free at the number on your screen until 9 p.m. You can also visit our website at www.azpbs.org/dentist for more information and links to additional resources. Thank you for joining us. I'm Ted Simons. Support for Ask an Arizona Dentist has been provided by the Arizona Dental Association and the Central Arizona Dental Society.